Never run out of battery again with the INIU portable charger, the slimmest 10,000 milliamp hour power bank that keeps your devices charged on the go. Stay powered up wherever you go. Click the link in the video description to shop now on Amazon.
It's D-Day for social care. If NI Rise passes, the consequences will be devastating. We use your sign-up to provide content in ways you've consented to and to improve our understanding of you. This may include adverts from us and third parties based on our understanding. You can unsubscribe at any time. Read our privacy policy. The future of social care hangs in the balance as MPs prepare to vote on amendments to the National Insurance Contributions Bill. This is not just another routine decision. It is a moment that will determine whether millions of vulnerable people continue to receive the care they desperately need, or whether an already overstretched sector is pushed further towards collapse. The consequences of this vote will be felt by families, care workers, and the NHS for years to come. The House of Lords' rejection of the government's proposed employer national insurance hike for social care providers was not just welcome, it was essential. The care sector is already operating on a knife edge. Staffing costs dominate budgets, and for many providers, there is simply no room left to absorb further financial pressure. Yet, if this bill passes without an exemption for social care, the consequences will be devastating. Some businesses will collapse, care workers will lose their jobs, and families who rely on support for elderly or disabled loved ones will find themselves abandoned. The warning signs have been there for months, if not years. The Care Provider Alliance has found that 73% of providers will be forced to refuse new care packages without immediate government intervention. And nearly half of all providers, 47%, are preparing to hand back local authority contracts because the fees councils pay simply don't cover real costs. Providers Unite 2025 survey. Councils themselves are struggling. Many can now only afford to provide the most basic social care services, leaving vulnerable people unsupported and breaching the very principles of the CARE Act. The system is crumbling. Successive governments have failed to properly fund social care, despite countless warnings from experts, charities, and providers. The aging population is growing, demand for care is rising, yet funding has never kept pace. The last 14 years have seen multiple consultations, commissions, and policy papers, none of which have delivered the urgent, tangible reform needed to keep social care sustainable. The proposed national insurance increase is just another example of politicians failing to understand the financial realities of the sector. A tax hike on employers won't fix the crisis, it will accelerate it. This isn't just about social care, it's about the entire health system. A well-funded, functioning care sector prevents unnecessary hospital admissions, keeps older people safe in their own homes, and ensures NHS beds are available for those who truly need them. Without it, more elderly patients will be left with no option but to turn to A&E, further clogging an already overwhelmed NHS. The Lords have already sent a clear message. This policy is flawed and must be reversed. Now, MPs have a choice to make. They can stand up for the care sector and ensure this damaging hike is scrapped, or they can stand by as providers go under, care services unravel, and families across the country are left struggling to cope. This is more than a financial decision, it is a moral one. If the government truly cares about protecting society's most vulnerable, then MPs must act. Exempting social care from this hike is the only responsible course of action. Anything less is a betrayal of the millions of families, workers, and older people who rely on it every single day.